There are no shortcuts any place worth going. Beverly Stills. The blizzard was a maelstrom outside, a swirling vortex of snow against the hangar window. After the pilot's weather check, I'd been reassured that we wouldn't fly that night. So I'd stayed up late, indulging in a few movies before turning in around 1. 30 minutes later, the radio's shrill tone jolted me awake. I stumbled out to take the call. We were being dispatched to a scene 90 miles away. A vehicle had careened off the road, crashing through a fence and into a tree. There were 3 patients, 2 of whom the EMS crew hoped we could transport. Scant details were par for the course lately. I pulled a bulky sweatshirt over my flight suit and activated my chemical hand warmers. The aircraft's rear compartment heat had been malfunctioning all weekend, and my fingers needed a break from the biting chill. Our flight path took us northeast, and shortly we were landing at the scene. The helicopter's descent, the rotors churning through the snow, was a mesmerizing spectacle. Our pilot expertly guided us through the trees and power lines, the near whiteout conditions a testament to his skill. We leapt from the aircraft, racing to the scene. Both patients were already immobilized, their necks braced and IVs in place. The male victim's injuries were less critical, but his female companion was seriously injured and visibly pregnant. They were both sheltered inside the ambulance. She had a closed head injury, open extremity fractures, and plummeting blood pressure. We administered IV fluids, intubated her in the back of the ambulance, and quickly transferred her to the helicopter. My partner wedged her backboard at an angle to displace the uterus from the major abdominal vessels. Her blood pressure rose slightly as the pilot pulled on the collective, launching us skyward. We landed on the roof in what felt like a blink of an eye, rushing both patients down to the ED. The trauma and OB teams were stretched thin. The ED was overflowing, a cacophony of chaos tonight. Every team member seemed preoccupied, and the usual army of specialists was noticeably absent. The male patient's injuries were minor, cuts, scrapes, and bruises. Despite the tree impact, nothing was broken, and this careless driver had no internal injuries. The female patient was in critical condition, a closed head injury and a reported 27 weeks pregnant. The trauma and stress had triggered uterine irritability, threatening premature labor. Despite the gravity of this case, the OB resident remained surprisingly calm. Our patient's leg was mangled, the bone fragments protruding through the skin, and the hastily applied EMS dressings. The orthopedic resident straightened it quickly and applied a splint. The OB resident and neonatologist monitored both patients while the trauma team completed their assessment. The most pressing damage was a vascular injury to her leg. After a heated debate between OB and ortho, the patient was taken to angiography to assess the leg's viability and try for a salvage procedure. This step only if a CT of her head didn't necessitate waking the neurosurgeon. Her uterine contractions had subsided, and her vitals were stable for the moment. The head CT was clear. The interventional radiologist agreed to rush back to the hospital and perform the angiogram. His team was in-house and ready for our patient. These wizards work fast, but the news was not good. Significant vessel damage. A stent was not going to work. Surgery was the only hope, but the available vascular surgeon was busy in another case. The team rushed her up to the OR on ortho's orders. Time was spinning wildly out of their favor. The weather had worsened, grounding us on the hospital roof. The pilot and I snuck into the cafeteria using a secret after-hours code to access the treasure within. We fueled up with Diet Coke and still-warm cookies, a precious commodity. Wide awake, wired, and with nothing to do, I decided to tag along with the crew to the operating room. I changed into scrubs and promised to keep my flight radio nearby in case the weather improved. The OR was a hive of activity, a sterile, antiseptic world where life and death hung in the balance. I was the senior here tonight by accident. As the chief resident of the EM residency program, the weight of responsibility sat heavily on my shoulders. Tonight's team, a motley crew of junior residents, a seasoned anesthesiologist, and a grizzled orthopedic surgeon, was a microcosm of the medical profession. As the case unfolded, the orthopedic surgeon shook his head, silently acknowledging the gravity of the situation. "There's no way to salvage this leg," he announced. Amputation was the only option, a horrific prospect for a young mother. She was in her early 20s, had several other young children, and now faced the loss of a leg above the knee. It is a daunting recovery for anyone, let alone a busy mother. A wave of sadness washed over the OR, but within an hour it was replaced by something else. Amputations were relatively straightforward surgical procedures. As the surgeon finished the final sutures, the OB resident grew agitated. The cardiotocographic monitor revealed a disturbing pattern, significant contractions and decelerations in the fetal heart rate. This was clear evidence of fetal distress, likely caused by a placental abruption, a result of the traumatic accident. The placenta had torn away from the uterine lining, causing massive internal bleeding and placing the baby in mortal danger. Immediate intervention was imperative. Failure to act would result in the certain death of the unborn, and likely the mother as well. The OB resident informed the anesthesiologist that a crash C-section was necessary. This was a down-and-dirty procedure, as quick as possible. Looking around, I realized we were underprepared. The orthopedic surgeon had left, and the first-year resident stared at me in terror. The OB resident, a beacon of calm, prepared for the C-section without the supervision of an attending physician. The anesthesiologist had already called the OB floor requesting immediate assistance. Fortunately, the chief OB resident arrived swiftly to assist with the crash section. I called the hospital operator, demanding the on-call neonatologist be paged to our OR immediately. He appeared almost magically within seconds. The OB team handed off the 27-week premature infant to the skilled hands of the neonatologist. He deftly intubated the baby and placed an umbilical catheter, and his nurse performed chest compressions while bagging oxygen into the tiny lungs. An intense silence followed, broken only by the ticking clock. The neonatologist shook his head, his eyes filled with sadness. He announced the time of death at 2:47 a.m. The emotions awaiting this mother upon awakening were beyond any comprehension. I accompanied the OB resident to the waiting room, a somber procession. We wanted to address the family collectively, including the husband, who was already discharged from the ER and sat smugly in a wheelchair. The social worker ushered everyone into the only available consult room, a sparsely decorated space with chairs and boxes of tissues. We delivered the news, the child's death, the mother's lost leg. The words hung heavy in the air. Then a family member shouted, "He's a piece of shit!" Chairs were aside, and tempers reached a fever pitch. Uncertainty flickered through us all. Patients and families often reacted unpredictably to bad news, sobbing, disbelief, denial, anger, hostility, even violence. The hostility was palpable, a venomous cloud hanging over the room. The husband, a man haunted by a known seizure disorder, had made the fateful decision to discontinue his medication, a gamble with his health that had proven disastrous. Fueled by alcohol and sleep deprivation, the perfect storm had brewed. The man's intoxicated seizure had shattered the fragile balance of life, claiming the unborn child and leaving the wife maimed. The weight of his actions was a crushing burden, a constant reminder of the consequences of his reckless choices. As we left the room, the adrenaline rush that had fueled us through the ordeal began to ebb. The weight of the tragedy settled upon us, a heavy, oppressive blanket. In the quiet of the hallway, I felt a profound sadness for the mother, a woman who would soon face the full brunt of her sorrow, the raw pain of her injuries, and the haunting specter of her loss. As I turned away from the maelstrom of family anguish, my gaze was drawn to a pair of uniformed officers, their determined strides carrying them toward the husband. The moment of reckoning had arrived.